Hi, it's Tuesday Talk with Rebecca, nurse practitioner.
And Jenna, master esthetician.
From Iona Aesthetics, and we're here to talk to you about microdermabrasion. So we have a new treatment here at Iona. We are super excited to be offering this to our patients, and it is a facial treatment that you can come in. It's an exfoliating treatment. So what exactly is microdermabrasion? So it's non-invasive. What does that mean? It means that we don't penetrate the skin and go underneath, like with microneedling, how it's multiple micro needles that create that injury. That does not happen with this. So a non-invasive treatment, and it's used to just exfoliate the skin. It has those diamond crystals on the tip, which go in and, like we said, exfoliate. That just means that it's getting the skin cells to remove the dead ones that we don't want on there so that we can have beautiful glowing skin. And then it also has a vacuum that sucks up those dead cells. So you can kind of see with the treatment what we're removing from the skin.
So how often should you get this, and then how many sessions? So we recommend that it can be done up to every 8 weeks. But you can also get it frequently as every week. We don't recommend that. We recommend every 4 to 6 weeks for about 6 to 12 sessions to see those optimal results.
And the reason we recommend it every 4 to 6 weeks is because of how the skin cycles. It has a cycle of every 4 to 6 weeks. So that means that you're turning over those skin cells on your own naturally. And so if we're able to do the treatment every 4 to 6 weeks, we actually can hit it at the peak. And then that way we keep building upon what we've already done. So that's why the 4 to 6 weeks rule is kind of in play. And it really is for most of our facial treatments. That is what we recommend. What else about this? So what exactly does microdermabrasion do? I'll have Jenna kind of talk about that.
So it can help with your fine lines and wrinkles, hyperpigmentation, pores, acne, blackheads, like the dull, uneven skin. Again, it takes off that layer of skin so that the new collagen can produce new skin and new brightness in your skin. Also sun damage, melasma, scars. It's kind of like a less, like she said earlier, like it's non-invasive, so it's no downtime afterwards. You might be a little bit red and stuff, but it has the same benefits as microneedling, but not as intense.
Yeah. So when we kind of look at all of our treatments on like a spectrum, we put our facials at the beginning because they're very light exfoliating. We're really just using masks. We're not using really much of anything that's mechanical to help take those dead skin cells off, but the masks are effective. Then we would say, I would probably say go to like a chemical peel, or do you feel like microdermabrasion is less exfoliating? Probably microdermabrasion first, yeah. So then that way that's kind of just exfoliating those dead skin cells, getting them to come off, but not really penetrating past the epidermis, which is your top layer of skin. And then we would go to a chemical peel, and the chemical peel is going to penetrate the epidermis, and if you do a deeper peel, it can actually get down to the dermis, and it's going to slough off those skin cells, and it's actually going to peel off. And then we would go to microneedling. So microneedling, again, is just creating those microchannels in the epidermis. Sometimes we can reach the dermis in certain areas. So again, just exfoliating, getting those dead skin cells removed, creating that collagen because we're creating the injury in the skin. So everything's about collagen. If you've been to Iona, you know we love collagen, and that's what this treatment does. So we hope you learned something. Be sure to like, comment, subscribe, and share this with all your friends, and we hope to see you at Iona soon.